Salivary diagnostics is a very interesting topic. Having read about the basics of saliva, we would now look upon the most interesting applications of saliva, the salivary diagnostics. Here I am again, Dr. Ramya, with you to talk about salivary diagnostics. So, this is the lecture outline about the salivary diagnostic topic. We have already read about saliva, and we know that saliva is a very interesting biological fluid which is secreted from the major salivary glands and the minor salivary glands as well. And saliva has a lot of interesting roles to play, which includes mastication, chewing, digestion, remineralization activity, and buffering activity. In addition, it also provides a protective role against all microorganisms like your fungi, bacteria, and viruses. As we say that it offers a lot of protective activity, then why do we actually get into having a lot of diseases? Saliva does protect only when the balance is lost that the disease state occurs. Otherwise, nature has bestowed upon us a very perfectly kept balance, which, if maintained, would really keep you in perfect health and wellness. And how is that saliva can be used as a diagnostic fluid? Because most of the biomolecules from the serum actually come into the saliva through many types of methods like ultra diffusion, transport, active transport, diffusion, and we also have sal- the biomolecules of serum enter serum can be seen in saliva also. Because of that availability of biomolecules, saliva can be used as a diagnostic fluid. The next interesting thing about saliva, which we have to be aware of, is that the advantages of salivary testing is that it is non invasive. This particular point is the most important deterministic factor about salivary diagnostic, because the moment we say non invasive, it means that there is no drama involved in collection, there is no prick or no pain to the patient. So, in that way, this can be tested even in a newborn child without causing any harm. So, it is non invasive and it is very easy to use and inexpensive as well. Additionally, the other factors which add on to the advantages is that it is more safer when compared to serum, because where serum is collected, there are a lot of pinpricks involved to the person who is collecting, and saliva can be collected with a person who with lesser expertise than what the serum collection is requires. So that is a very important factor. And another thing is, suppose if that particular testing needs multiple pricking again, it is again multiple samples without any discomfort to the patient. And no other important things are, it is not as sensitive in storage requirements. All that makes it less expensive. So it is non-invasive, more safer, and allows multiple testing, and it also is non-expensive. And coming to the importance of what is present in saliva, the most common thing which is actually validated, or the most common thing which is tested, is the salivary proteome. So, in the salivary proteome, we have multiple options which the saliva offers. So, as the word proteome is coined, proteome is nothing but a genomic expression of what is there in a particular cell. So, as the cellular components of the body puts out its proteomic profile, all that is manifested in saliva as well. So, in the saliva, we have antibacterial properties, elements which can confer antibacterial properties, those which can confer buffering properties, those which have antiviral properties, those which have digestive properties, those which confer antifungal, anti mineralization properties, those which have tissue coating properties. So all this put together actually contributes to the proteome, and definitely that sounds really offering a multitude of challenges in salivary proteome. The main challenge is always that the quantity of the biomolecules present in saliva is lesser when compared to serum. That is the very important challenge. So we saw that most of the biomolecules are present in saliva as well in compared to serum, but the amount which is present is lesser. As the amount which is present in is lesser, what happens is you need very high sensitive technique to detect them. And in addition, there are other factors which contribute to difficulties in obtaining or validating the salivary proteome. That is, it can be affected by the time of collection, the degree of the hydrated status, for example, how much of water do you take at that particular day of testing, the position of the body, psychological stimuli, drug intake, health related behavior, and the basic systemic and oral health of the individual all have a definitive effect on the salivary proteome. So all these have to be kept in mind when you're deciding on the inclusion and diagnostic testing. And another important thing is the entire laboratory setup should be well equipped with whatever is required for salivary collection, handling, and processing. And next we move on to salivary transcriptome. So transcriptome is where the nucleic acids, that is your DNA, transcribes into an RNA, and then RNA becomes protein. But because salivary proteome is the one which is frequently done, salivary transcriptome is being discussed now. So we have around 3000 microRNAs which are there waiting to be measured and validated in the saliva, and that is definitely an interesting number. So in addition to the mRNAs, we also have DNAs which can be isolated, which can be very suggestive of specific disease conditions. Now we move on to what are the areas which diagnostic applications of saliva can give us, or saliva, very broad areas which saliva can offer. The first one is medicine, dentistry, and pharmacotherapy. Additionally, we also have epidemiology, where the fields which saliva can be used to a greater deal. If you see the field of medicine, you can see that the entire course of subspecialties of medicine can utilize saliva as a diagnostic tool. Dentistry as well. Dentistry is the one which actually brought out salivary diagnostics into the world. And then pharmacotherapy. Pharmacotherapy is again a very interesting area where we can use saliva for testing the pharmacovigilance or the pharmacokinetics and the dynamics, what the drug is doing to the body and what the body is doing to the drug. Both the ways it can be tested. And in addition, drug abuse can be tested in pharmacotherapy aspects. Epidemiology again has a very huge scope in providing with the help of saliva. Next is caries risk assessment. These are specific topics related to dentistry. Caries is actually the most common disease in the human beings. It ranges around 70 to 80%. It affects 70 to 80% of the whole world population. Most common disease which the human beings actually, having said that, it is more prevalent beforehand to derive preventive regimens. So when we are deriving or thinking or planning of a preventive regimen, we need to know the process of caries, because that again is multifactorial. So we have to decipher it in varied components, like assess the etiological factors. The microbiome can be assessed, the microbial factors, or the proteomic signatures, the genome part of it, and the transcriptome part of it. So any of these can be used to assess the caries risk, so that we can actually derive very effective preventive programs. When I say microbiome approach in caries risk, we have the microbes associated like the Streptococcus mutans, Streptococcus sobrinus, and Lactobacillus, which are very important caries risk microorganisms which can be easily tested. And then we have the advanced testing using the proteome signatures and the genomic signatures. So with all these, we have very advanced testing methods like testing kits, which are available as dip slide methods, your broth method, and the DNA hybridization method, genomic fingerprinting using RNA. And you also have RFLP and DNA sequencing methods. So with all this, what could be the etiological factor, and is that particular person vulnerable to caries even before development? So this can be done in very young children, so that the parents can be advised on how to manage with the caries, or how to avoid or how to prevent caries. Advanced techniques, there are very simple things which saliva can offer as far as caries risk assessment is concerned. That is to monitor salivary flow rate, to monitor the salivary pH, and to monitor the buffer capacity. Again, I told you that caries is the most commonest or highly prevalent disease in human beings. Next common human disease is periodontitis. So periodontitis again is very, very common disease, and having said that it is common, we need to derive every possible step to prevent and give effective treatment regimens. This particular disease, as you can see the picture, as the tartar or as the calculus keeps depositing on the tooth surface, there are millions of bacterial accumulation in this particular area, and that causes inflammatory episodes. The inflammatory episodes can cause connective tissue or tissue destruction, and it can cause destruction of the hard tissues as well, or bone, that is bone destruction. So that is what you can see over here. There is redness of the gum region or the gingival region. That is because of tissue breakdown. In case if we take a X-ray for this particular patient, we can very well understand that there will be bone loss. So there is tissue destruction and there would be bone loss as well. So this process is very nicely monitored by either assessing the microbial population or assessing the inflammatory mediators, which are inflammatory mediators. Inflammatory mediators can be monitored. So with all this in mind, periodontal disease can be very easily monitored using saliva. And next we move on to another interesting area of dentistry. All of us know and all of us have seen people wearing braces. And these braces are used for alignment of teeth. When the teeth are crooked, to align it in proper place so that you have a very beautiful smile. That is what orthodontics is. The main part of orthodontics is all about. There are other very deeper areas, but so as the teeth are realigned using fixed orthodontic treatment, what happens is there is a sequence of events which happen behind the alignment. When the force is applied, there is either resorption or deposition. So to monitor how much of resorptive activity is happening, how much of deposition activity is happening, can be more in-depth observed or can be more effectively monitored. So monitoring the tooth movement with inflammatory mediators makes it a more sensitive method than monitoring it through clinical or radiographical methods, because by the time you can see a clinical manifestation or by the time you see a radiographic manifestation, the changes are there witnessed in the inflammatory mediators. So if you can observe the inflammatory mediators in orthodontics during orthodontic treatment, if it can be observed, then it would be a great help to the patient, and that in saliva again reduces a lot of burden in orthodontic management. Next we move on to a more crucial area in diagnosis, and that is oncology. Also well established in monitoring pancreatic cancer, breast cancer, lung cancer, and gastric cancer. Most of the etiopathological mechanisms or the pathogenetic mechanisms, to be more specific, the molecular basis of cancer, are all reflected in saliva. So that having that promising statement in mind, so this salivary biomarkers. There are a very big list which are specific for oncology related monitoring, can be used for monitoring in cancer patients. As I say, monitoring, so at which stages is it helpful? It can be used as a preventive detection. So for those patients whom we think are more at risk, can be they can check their salivary status and see if there is a cancer risk. And for those patients who are actually just recently detected, it can be used for diagnosis, that is detection at that particular time, and then it can also be used for a prognostic follow-up or a progressive follow-up, which is very very important in cancer patient management, because as the patient is subjected to therapeutic stages, we have to see whether the cancer is coming down. So there has to be a effective monitoring tool at various stages. So at that particular stage, the patient, in spite of just giving multiple pricks and then multiple samples, if they can just give saliva, it would be a great help for them. So that, because we are offering a non-invasive tool, and the most common markers which are used for oncological monitoring of salivary biomarkers are anti-P53, CA125, CA2. So these are the common markers. And the methods of salivary detection of salivary biomarkers, listed here all sound very very big. They are not very simple because of the main reason that the biomolecules present in saliva are very very less in number. So as the amount is less, again to reinforce, we must remember the fact that most of the biomolecules present in serum are present in saliva. That is the important statement. Having said that, but the challenge lies in the amount of biomolecules present in the saliva. So that is lesser when compared to serum. But all of them are present. Considering the advantages which saliva can offer, so what should we do? We have to definitely go in for very highly sensitive, very advanced diagnostic methods. So that is why you have a range of very high-end detection methods. But I'm sure if the government machineries are identifying the importance of this very interesting field, and if they can fund in enough sources, then salivary diagnostics will really make a very big mark. So how do we detect these salivary biomarkers? So what are detected? So we can see that there are organic, non-organic markers, there are peptide and protein biomarkers, there are DNA, there are metabolic biomarkers, and there are other miscellaneous markers. So one thing we have to remember here again is that there are very advanced techniques which are required. And now we move on to a very interesting area of salivary diagnostics, sports medicine. So this sounds really this really arouses lot of curiosity. So how does saliva help in person is involved in lot of physical activity, a very active lifestyle? What happens is the person is subjecting the musculoskeletal system into a lot of action. So as the musculoskeletal system is put into a lot of action, there are some enzymes which are released into the systemic circulation, and they can be monitored very effectively by serum. If it's serum, it's going to be saliva also. So with that, what can we do to the sportsmen? So those who are having a very rigorous practice, they can be told that you can lift so much of weights, and this is going to be your markers of what you are doing to the muscle, and do not go into weight lifting more than this particular level because that is not doing good to your body. Something like that can be very easily derived by using saliva, and all this can play a very important role in fitness testing and in training young children and young adults who will be representing the country at national and international levels. And then we have forensic medicine. Forensic medicine, as the name suggests, is again a very vital field where there is lot of investigations which are happening, and it also identifies the victims as well. So saliva offers a multitude of options in forensic medicine also. So it helps to differentiate individuals who are still alive and those who are dead as well. Interestingly, there are other areas which it can offer. So DNA can be extracted from saliva and that can be used in individual identification. So that makes a very big impact, especially in mass disaster victims and in many other situations where the victim or the criminal leaves a trace of salivary sample in the area of the crime. So if the particular forensic team can identify that trace of saliva, it can actually make a very big difference. Pharmacotherapy, as already mentioned, what the drug is doing to the body and what the body is doing to the drug, everything can be monitored with the help of saliva. And these are the list of drugs which actually have been proven to be present in the saliva and which can be efficiently monitored. Very simple example is that if you keep smoking, cotinine levels, even how much of cotinine is still present in your saliva after a single cigarette smoke. So that all that can be monitored and that can be very effectively used for advocating tobacco cessation programs. And in addition, drug abuse is one very drug abuse is one very serious area. Drug abuse is most of the addictive agents. Most of the opioid addictive agents can be easily monitored by using saliva. We know that drunken driving is a crime. So drunken driving can be very easily monitored by breath test. Additionally, saliva also can offer as a supporting test. Then we move on to how much of metabolic activity can be monitored in saliva. And as we say metabolome or metabolic activity, we know that the most key areas of the salivary metabolome or the metabolic activity in the body revolves around the carbohydrates, the lipids and the proteins. If all of them can be evaluated or can be assessed in saliva, then it is offering a huge scope which actually can be monitored. As we say metabolic activity, we know that if this metabolic programming or this metabolic activity in the body is not balanced, it is going to lead to a disease state. The most commonest metabolic disease in the body is diabetes mellitus, and in India we know that we are the diabetic capital of the world and we have the most highest number of diabetes patients, and that is a best example of a metabolic disease. And saliva can be used as a diagnostic tool in measuring and monitoring glucose levels. So this glucose levels, we know that there are many patients who have to keep checking glucose levels by pricking, and we know that there are kits which are available. There have been a multiple number of studies in literature which suggest that salivary glucose levels can be used as a reliable measuring device to monitor diabetes mellitus. In addition, we also have other suggestive markers which are indicative of diabetes mellitus. So the other things which can actually help in monitoring the disease are your myeloperoxidase, IgA, and it also helps to detect HbA1, which is a more reliable testing than the salivary glucose. And also it also helps in monitoring the pH, as how diabetes is altering the pH. So, and now we move on to neurology. So as we see this particular area, and everything revolves around the brain. So as we say such a statement, so what happens? There are some diseases related to the IQ levels of the patient. We have done in our own lab about the patients who are having attention deficit syndrome. We have measured biomarkers in kynurenine pathway and serotonergic pathway, and we have found that these pathways which are functioning in the brain can be effectively monitored in saliva. So as we say, attention deficit syndrome can be monitored. You know that ADHD is very common in very young children who are having learning difficulties. So if they can actually be detected at an early stage and inform the parents and inform the educators, the lesson plan for them would really make a very big difference in that child's life. And we move on to other serious problems related to the CNS. We know that the brain is subjected to neurodegenerative mechanisms as we keep aging. The most common disease here is Alzheimer's disease, which is a more common neurodegenerative disease, and that involves elevated levels of phosphorylated and total microtubule associated proteins related to a mature neuron. So all these can be effectively monitored. So in case if a patient is feeling that he's having memory loss and so on, or if the parent is suffering from Alzheimer's disease, and if that the son or the daughter wants to know if he or she will be vulnerable to Alzheimer, yes, we can definitely check with the help of saliva. And we also have other interesting suggestive markers like nerve growth factor, sensory neuropeptides, which strongly correlates with severity of pain in patients diagnosed with chronic migraine. So we know that mind is a very important, that is, brain is an important, and as already mentioned in Carey's risk assessment and periodontal risk assessment, microbiome, we know that interestingly here we have microbial population which can be detected in early stage of pancreatic disease. Bacteria such as Neisseria and Streptococcus mitis play a very important role during early stage of pancreatic cancers. So such important statements make a very big important role in prevention as well as in deriving therapeutic strategies. And now we move on to what are the technologies available for salivary diagnostics. We already discussed about the methods of salivary diagnostics. So those are the methods which are involved. What if we can have them as point of care testing devices? Point of care testing devices are very vital for disease management, because all that we have to do is it should be a self-assessment kit. Is that possible for saliva? Yes, there are many kits which are available, and many kits are in the making. So the ones which are right now available are your salivary fluid nanosensor test for cancer detection and periopath for oral DNA assessment. We have the oral cancer risk HPV testing. So we have multiple options of point of care devices available, that is OFNA set for oral cancer, periopath for periodontal disease, and oral risk for oral. We have multiple point of care devices which are already available, that is used for cancer detection, perio risk detection, and in oral cancer HPV detection. So how does these point of care devices work? So they are based on microfluidics, or they are based on micro and nano electromechanical system. So this is a very simple schematic diagram which actually tells about the interface which is involved. In addition, there are other interfaces which are commonly used for salivary diagnosis, that is your RT-PCR, other fiber optic microsphere based arrays, DNA microarray, surface plasmon resonance based fiber optic sensors, and microchip based electrophoretic assays. So with this we end the salivary diagnostic lecture. So what I would like to you to know is young minds to bring in more advanced interfaces to detect that interesting biological fluid and to make the world a better place. Thank you.